So let's get the meeting started. Sawyer County Health and Human Services. Can we have a roll call?
Yes, here.
Here.
Here. Marshall Savitsky,
Here.
Michael Maestri,
Here.
Chris Rusk,
Here.
Lorraine Gouget, Dawn Pettit. Dawn Pettit. Oh, she's signing in again. Taking roll call, Dawn Pettit. Carol Pearson. Sabrina Dunlap.
How many do we need for a quorum?
I'm here.
You've got a quorum.
Okay, good.
And
This
Carol,
is Dawn Pettit. I'm here. I had gotten booted off.
we got you.
Okay, thanks.
Okay, let's stand for the Pledge of Allegiance. Pledge allegiance
To
to
the flag
The United
of the United States of America
to the republic for which it stands,
and
one
the nation under God, indivisible, with
liberty,
and justice for all.
certification, compliance with open meeting laws.
This meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Okay, agenda, meeting agenda. I understand there's a few changes.
No, push your little red button. There you go.
Oh, there it is. Okay, yes, I would like to strike 13B and change 14B to Economic Support Specialist and Case Manager Week.
Okay. When we get to them, you can just go ahead and, any other changes or questions? Can I have a motion to accept the agenda as amended? Do we have thank you. We have a motion and a second. Everybody in favor, say aye.
Aye.
Okay, motion passed. Public comments. Do we have any public that wish to speak? Anybody? Nobody online? Okay. Consider approval for minutes of last month's meeting. Thank you.
I'll second that.
Thank you. We have a motion and a second. Everybody in favor, say aye.
Aye.
Okay, motion passed. Now we are at 8, yeah. Behavioral, no.
Committee reports.
Yeah, committee reports. Okay, thank you. Is Lorraine with us?
Nope, we don't have Lorraine, and we don't have a report from the Senior Resource Center. I don't think Joey is on.
Joey is not here, but I can report
perfect.
on just a short note on behalf of the senior center. They have been doing some fundraisers. The most recent one was selling brats at Lynn's where they raised close to $1,500. We're also going to have a brand new one. This could be selling tickets for a grill and grilling supplies and cash prizes. So watch for that to come out.
Thank you. Okay. Administration.
Okay, so one of the things that we have been talking about as a leadership team is the need to have all staff meetings again, which we have not had in quite a number of years. We've had quite a bit of staff turnover, and it's time to start getting us back into some training. In the past, we have had days off where we're closing the agency for half a day in order to do the training and meeting time. And I would like to request that we would have 3 days coming up over the next number of months. So one in September, one in January, and one in May, where we'd be closed for a half a day in the morning. And be able, and it'll be based on finding a site that we can all be at, and I can bring those dates, but need to ask for approval to close the agency for 3 mornings.
Okay, any discussion? Questions? Concerns? I assume you'll notify the public.
Yes, we'll make the notifications to the public
Okay.
and get that out. And at the next meeting, hopefully we'll have those dates solidified.
When you say you're looking for, not sure where to have.
Well, we'll
it,
need to
here and-
have a place that's large enough because we do have about 50 staff.
Yeah.
Yeah. So working probably with some churches and finding a place that's close to be able to have that at. But
Okay, and we need to have a vote to approve or disapprove. And then,
of being able to close the agency for 3. Yes.
yeah, and then. Okay, do I have a second? Thank you, Kay. My question is, can we do this, or does this go to the full county
It
board?
can be done from the HHS board.
Just here?
Yep. Just
Okay.
here. Thank you.
Okay, any other questions? Everybody in favor, say aye.
Aye.
Motion passed.
Aye.
Thank you. Did you have more?
Nope. We can keep moving on if we would
Okay.
like to.
Sure.
Okay, moving on to adult long-term care. Sarah, our previous supervisor, has provided a report in here for all to read. One of the a couple of the updates that is not in the report is that we did have interviews for the position of supervisor for the adult long-term care unit, and we have put an offer out and has been accepted by Carol Martin, who has been with the agency for a number of years, most recently as the elder benefits specialist. So she will be moving in as of July 17th, moving into that position. We'll need to retain the work of the elder benefit specialist as we're recruiting for her replacement. So we're excited to be able to have Carol brought on board. In addition, I have been meeting with the staff weekly during the transition from Sarah to Carol, and we continue to see quite a bit of traffic and referrals for the ADRC. A lot of the counties are reporting the same thing, where that there's definitely an increase right now, and are noticing an increase in the complexity of those cases. So we'll continue to monitor that to see if that is a new norm, or if it's just kind of a spike up for a period of time as benefits are changing. We'll monitor that. Carol took the adult long-term care supervisor / APS. Okay. Any questions on that? Okay, moving on then to behavioral health. We have both the report from Alicia and the mental health cost by client report. Alicia, did you have anything additional that you wanted to add?
No, I do not.
Joe, you're here. Do you have anything that you wanted to add?
No.
Okay, does anybody have any questions on those reports?
I think.
Okay. Oh, Carol, you.
I need to turn on the,
Carol Pearson.
Just talk close.
All right, thank you. I was wondering about the new hire in that department. Are there any interviews set up or
For the
mental health?
therapist?
Yeah,
We have not received any yet. We're going to look at, I want to try to do some additional type of marketing, hopefully, on that position and kind of re-push out. So
okay.
any suggestions? Anybody out there that knows anybody? Refer them over.
No. Thank you.
Okay. Moving on then to Child Protective Services, the Children in Care Expense Report. I did not put that on or get it linked, but it is in front of everybody here, and also just got emailed out to those of you who are online. And then the updates for Child Protective Services is we are now fully staffed except for the supervisor position. Jackie Sully will be starting on the 17th or that week. She will be our family aide. And so that fills in those positions. We again are still recruiting for that supervisor position. We do have an interim supervisor that is supporting us 20 hours a week, and she will be coming up now next week for 3 to 4 days to do training in person with our staff now that we're fully staffed up. So we're looking forward to that.
You're on a roll.
I'm on a roll, but I got a tickle. Okay, any other questions with CPS? Youth Justice has some updates as well. We are currently looking at some grants that would allow us to do some diversion programs. So more to come on that, but just wanted you to be aware that we're looking at some alternatives in that manner. And also we, and this is one of the other positions that's been filled, Shannon Kraus was hired as a youth justice caseworker, and she's coming over from the courts. So we're working on that transition of bringing her over, getting her trained in, and still backfilling that position. So it's going to be a little bit of a transition period as we work through that. But she has started training now with Sarah Anzauskis, so who is our lead youth caseworker. So moving forward on those pieces, I did strike the fee schedule request that I will be bringing that back next time. And just so you know what that is we are doing drug screening, and we'll be doing more of that as part of that program. And we don't have a fee schedule set up for that. So need to bring that forward. I just need to look at some tests and some costs, which I thought I would have done for today, but we'll bring it back next week.
Are those tests
Or next month.
for the sheriff's department?
Nope, it's for those that are in the youth justice program.
Oh, okay.
Mhm.
Oh, go ahead, Carol.
May I ask a question? I'm Carol Pearson. I read in my minutes that the youth justice costs are going to be much higher. Is that because of the caseload?
Yeah, we're really doing more programming with them and bringing the case, and following those cases more. So, and we'll be working closer with the schools. We have a few more that are in residential care, which is also increasing the cost.
Okay, so the cost of care is up.
Yep.
And Patty, may I ask you, the anticipated amount, what is the overage at this point? Do you have any idea? I know that's kind of a pointed question.
Patty, can you just, maybe you could, you might just set, because, you're going to be having more. Little person should turn. There you go.
All right, this is Patty Dujardin. So I'm looking at the purchase service recap, and that does show, let me see, the juvenile justice. RCC, we only budgeted 100,000 and we'd already spent 170 in the first.
Mhm.
So you'll see when we get to the budget that we are anticipating an increase, and we did budget for and project that.
Thank you.
And Carol, I can add, one of the things that we'll be also looking closer at is what's happening with the CPS cases and residential care. And hopefully, as we reduce those, it'll kind of make up for the budget this
Sort of
year.
balance it out.
Mhm.
Okay. Because I was wondering where we're going to get the extra bucks.
Yeah, yep. So we're going to try to work through that.
Okay, thank you.
Anything else on youth justice? Okay, moving forward then into economic support. The update was provided by Shauna.
Mhm.
One of the things to note is that we are allowing overtime that's been approved through the consortium, so that fund, that increase is covered through the consortium costs. But due to the caseloads and the number of reviews that need to happen now post the change with the from COVID shift, they're definitely seeing much more of a level up there. So a number of our staff are taking on that overtime to help support this. And then the other piece is that this week, which is July 12th through the 14th, has been proclaimed Economic Support Specialist and Case Manager Week by the governor. And I missed getting that in there, so I will go ahead and read that for you. Whereas Wisconsin's economic support specialists and case managers work diligently to administer the state's public assistance programs, supporting the well-being of Wisconsinites and helping to preserve their financial livelihoods. And whereas the specialists and case managers work diligently to verify eligibility for the state's various public assistance programs and deliver timely and accurate benefits and payments in responsive, sensitive, and professional manner. And whereas economic support specialists and case managers are experts in their work and often volunteer on committees and work groups to improve systems, facilitate communication amongst state and local agencies, and execute policy changes. And whereas economic support specialists and case managers provide relief and support for the state's most vulnerable populations when they need it most, help promote independence, and work to reduce the impacts of poverty in communities through Wisconsin. And whereas this week, the state of Wisconsin joins economic support specialists and case managers across the state in celebrating the critical jobs they provide for all Wisconsinites. So we have a wonderful group working up there and wanted to make sure we acknowledge them.
Very good.
Just curious, did the governor send any extra money?
Yeah. Yeah, that would be nice. So we'll try to, as each one of these, we do have special weeks for a lot of the different areas, and we'll try to make sure we're bringing that forward so everybody's aware of the type of work that's happening in HHS.
Thank you.
Okay. Public health update. We have Julie here, and you can go up there if you prefer, whatever.
I'm fine here. I'm Julie McCullum, Public Health. Just wanted to give a quick summary of my report. We have seen an increase in tick-borne disease. This is not unexpected this time of year. We often see seasonal increases. Predominantly, we're seeing it with Lyme disease and anaplasmosis, just for your awareness. I also wanted to highlight that our water lab had its biennial evaluation by DATCP, and we are currently recertified by DATCP without any further follow-up needed. So that was good news on that front as well. I wanted to highlight that we are hiring 2 public health positions, including a public health assistant role and a public health nurse role, and they are all in process currently. On the agenda, you see that we have human health hazard discussion, and I wanted to highlight some of the efforts in the last month that we've done to make sure that our policies are in alignment with state statutes and our ordinances, as well as our assessment tools. We've reached out to other neighboring counties for their best practices. We reached out to the Northern Region DHS to give counsel, reached out to Corp Counsel to get legal advice, as well as working with our partners like the town of Draper. Some key takeaways in development in the last month is that we developed an assessment tool to standardize our process, to be in alignment with our current ordinances. And that is our human health hazard ordinance, as well as the state statute, which also does address human health hazards. It is a high threshold of evidence needed for public health to take action. The definition of human health hazard is a substance, activity, or condition known to cause acute or chronic illness or death if exposure to substance activity or condition is not abated. And so we've gotten good information from a lot of our partners just to streamline our process to make sure that we're handling complaints in a standardized way uniformly throughout the county. We've also developed a decision tree, and that's also in process to better handle these complaints as they come forward. Do you have any questions for me?
Anybody online? Questions?
Okay, thank you.
Does this
Sure.
play in with the situation in Draper at all?
Getting some feedback here.
Is it mine?
Sorry.
Does this play in, public hazards? Does that affect?
While I don't want to
situation?
talk about specific cases in an open meeting, this human health hazard umbrella does include complaints with regards to substances, activities, or conditions that might cause acute chronic illness or death. And so that is our umbrella, and that's kind of our measuring tool. But yes, as we receive a lot and other environmental health complaints as well.
But what does your department do once one of these health hazards has been identified?
So,
I'm sorry, I didn't mean to put you on the spot.
no,
I'm
no,
curious.
that's fine. So part of what we've really done to focus our efforts this last month, me as a new health officer learning and getting the best evidence and best practice from other counties, we have focused our efforts to try to make sure our policies and procedures are in complete alignment with our ordinances that are currently in place. Yes. So part of that is to make sure that our tools and assessment tools are clear, are in alignment, and we've sought court counsel as well to give us guidance throughout this process to make sure that when we receive a complaint, we're addressing it in a standardized way.
Okay. Thank you.
Yeah, and I can just add one of the additional pieces that we have kind of worked with and learned with the towns is how do we pass that ball from how do they pass it to us and how do we pass it back based on our assessments? So that's the other thing that we've worked on.
Okay. Thank you. Any questions? Any further comments? Okay.
Thank you.
Andy, did you want to, we're still kind of in administration. Did you want to add anything?
Yeah, I think I was just going to in part echo what Julia just said, is that public health handles these sites or places as the human health hazard portion. And they do their assessment, which they really work to standardize and define that. But then it's probably the question next is, if it's not a human health hazard, what is it? And it's once it's outside of a human health hazard, is it a nuisance? Or is it, what are the options that are available based on ordinance or policy that we have at the county? Or, like Julia said, is it at the township or municipal level that they should address it with the tools they have available to them? So I think that's maybe the differentiation is public health is human health hazard. And once it's outside, if they determine it's not, then what's the next step? And who takes it?
Was there anything else you wanted to address the board about?
No.
Okay. Fine. Where are we at?
Yeah, and then we are on to fiscal. So I'll turn it over to Patty.
I'm sorry, I didn't understand any of that whistle or whatever it is.
She's turning it over to Patty.
It's,
Oh,
it's,
yeah.
yeah.
Thank you. Go ahead.
Okay, so everyone has the budget performance report as well as the purchase service recap through May, showing where we are on our purchase services. And if anyone has any questions on those, otherwise we could go on to the 2024 Health and Human Services draft budget. This is for your review and consideration for passing on to the next level for the 2024 budget. Okay. Does everyone have a copy for their?
Yeah.
preview?
Those were emailed after the packet, so you might have seen them in a separate email.
Okay.
Okay.
I'm fine with this.
We all,
Oh, I thought that was. okay, never
that's the,
mind.
probably the budget performance report that comes, it will look,
I know that, yeah, I goofed here.
oh,
yeah.
you got it? Okay. So Julie will be right back. We'll wait for her and then I will go through it and for the sake of the new members, I'll go through it page by page and review how it's prepared. And for those that have had to sit through this every year, sorry, you'll have to hear it again.
While we're waiting for Julia, I did have a question on the budget when I was looking through. There's a line item that says purchased services, and I was wondering what that includes.
Your purchase service recap. And we'll go through this.
Okay.
But that's what this is every month. Okay. Okay, but okay, when we go through the budget, you'll see what the answer to that question for each and every unit. But then, since it's such a huge amount of money,
Yeah.
okay, I prepare this report, which is the purchase service recap, and it comes before this board every month. So that you can actually see, okay, this was the budget, where are we on pace with spending? Because if you're going to be busting the Health and Human Services budget in any place, it's going to be in purchase services of which we may not have any control. Example, our mental health, out-of-home placements, our children and family or juvenile justice out-of-home placements. So that's what this report, this is based on the adopted 2023 budget. But you get this every month, which is a recap of those. But then I'm going to show you in your budget report here, the budget that I prepared for you. It actually is broken down what the purchases services are per every unit. And it actually gives you a history of those back 10 years.
I don't think I've ever seen that.
It's more or less.
Right here. And that, this is what Julia's making copies of for you,
Okay.
in case you don't. It's a 14-page document.
This year to date, it's the last page of the packet.
And hopefully our board members online have copies of this as well. So we'll start with page 1. Page 1 is a roll-up of all the pages that are underneath it. This is basically the overview of the entire budget. On the left-hand side are the expenses for Health and Human Services by category. And you'll see that it's the direct expenses. The administration is the administration for Health and Human Services. The indirect costs is the administration of the county. The difference is the indirect cost is what it cost for the county to have Health and Human Services here. The admin costs are the internal costs, the cost of Julia, myself, etc. Okay. Then you have the 2024 total, the 2023 budget, and the difference between 2023 and 2024. On the right-hand side, you're going to be seeing the 2024 projected revenue by category. State is where we have either state funds or grants or outside the agency. MA is medical assistance, client is client revenue, and then you have a total. It then shows you below that the 2023 revenue projected, or what was in the budget, excuse me, what was in the budget for 23, and the difference between 2023 and 2024. If you look on the left-hand side, once again, you're going to see the amount of money that we are requesting, and the difference between what we requested in 2023 and 2024 is an increase of $150,067. Some key notes for this year's budget that we took into consideration is that a half-time adult protective services position was moved from being contracted to being contracted with another county, from actually being a staff person. We had a hard time finding a half-time position to be filled, so we partnered up with Iron County. They hired a full-time position and we pay them for half of the position. So it went out of the salary lines down to a purchase service. The other thing was we moved expenses from the Winnebago line to residential care. We didn't reduce anything. It stayed the same as far as what we are going to be anticipating spending on mental health out-of-home placements or residential placements. It's just that we had some of our long-term residents move from Winnebago, the state mental health hospital, into residential care out in the state. So we just changed where the funding is reflected. We did increase youth justice out-of-home costs because of, as Carol had previously asked, and we can go through that when we get to the youth justice page. Page 2 is the administrative expenses. This just recaps what the administrative expenses are for Health and Human Services. There is no money that directly offsets administrative expenses. You're going to be seeing this exact total, the $549,859, then by percentage based on full-time equivalent staff to each and every grant that accepts administration, so that we are pulling down state funding to pay for these sources, these services. Page 3, excuse me, is long-term care. This is your ADRC and your long-term care. Again, this sheet follows the page 1, where you've got your expenses on the left and your revenue on the right, and it shows you the difference between 2023 and what was in the budget and what we're anticipating the 2024 budget to be. Now, this really will answer your question. The first of your purchase services, page 4. This is the purchase services. So you'll see the 2024 budget all the way to the right shows that in the long-term care ADRC unit, we are budgeting $193,211. If you go back to page 3, you're going to see that figure. But this shows you in detail where it is. It also shows you back, I had to get rid of 2011 because it wouldn't print any, but from 2012 all the way through 2022, those are your actual expenses of what was spent. It shows your projected 2023, it shows your budgeted 2023, and then it shows you what we are anticipating to budget for 2024. So this shows you the history of where we spent and why we are thinking as we are. Any questions so far? Because this is the same format for each and every unit then. And then so those purchase services by each and every unit, you can now follow along on your purchase service recap every month because it will exactly follow that. And then every month I show you so here's the budget for 23 after it's adopted by unit. And then where are we spending? How are we looking? And this is why, and I do this because, again, within the budget performance report, that's by individual grant, and it would be hard to pick out where we're really looking. I mean, this, I think, shows you in a snapshot. If we're gonna bust the budget, where will it be? So that's why I do that. Page 5 is your AODA mental health expenses. Again, it's your expenses, your revenues for 2024, your 23 budget, the difference between the two. Page 6 is the purchase service recap for AODA and mental health. You can see the very first line is Mendota and Winnebago. In 23, we budgeted $1,100,000. I took that down to 500,000, but you will see that we did increase the residential care from 250 to 850. That is because we are projecting, as you can also see, that in 23, we're going to be spending 809,000 there, but it's just where the people are located. And that's, so bottom line, you'll also see the 23 budget and the 24 budget, it didn't change for our purchase services when you look at the very bottom line on the right. Children and family, this also includes youth justice in it. So here is where you will see a difference. Again, your page 7 is the expenses and the revenues. It compares them once again to 2023. Page 8 is where you will see an increase. We did increase from 1,583,960 in 23's budget to 1,614,460 in 24's budget. That's because on residential caring centers, we are projecting to spend 508,000, almost 509,000 so far, and in 23. And when we met, as I explained, we also didn't have the youth justice worker up and running the whole year yet. So they hadn't really been working with the kids and putting the programming in place. So it may be more than that because this is really only since she put this all into place. So we did increase the budget from 100,000 to 562,000 for RCC. And that's where you will see an increase in our budget there. Page 9 is economic support. You will see we have many programs that throughout the years, the state has given us a maintenance of effort. Long-term care is one of them. Economic support is another. And Julia had me write on these pages for you what the maintenance of effort is. So basically, if we did not have the economic support unit in Sawyer County, we would have to pay $98,487 to the consortium anyway. Plus, we would still have to offer services for people to walk in. So, because it has come up in the past, is this a mandated service? So not really, but really. So, again, here's your expenses and your revenues. And the only purchase services that we really do with the economic support is Sawyer County for the consortium is in charge of the fraud contract for the entire consortium. That's why we have the purchase services for the fraud contract for the consortium, and it runs through Sawyer County. So basically it's a pass through. Public health. You will again see our expenses and our revenue. You will also see the birth to 3 maintenance of effort written on here, which means that is the minimum amount that we can spend on birth to 3. However, I can tell you, we do spend much more than that. But it is a mandated service that anybody that comes in, we have to serve as many people as apply. So it's kind of moot at this point in time. But if ever we didn't have enough, we are mandated to at least offer that much in service.
What is your current population in birth to 3?
We're sitting, I think, around 24 right now. So a few years ago, I would say 2018, 2017, we only had 7 in the program.
Mhm.
So just to kind of give you the differential of where we've been running.
Page 12 is your purchase services for public health. And we did increase the birth to 3. That is just solely due to increased revenue for our therapy services. So therefore, we increased the contract line to match with the amount of revenue we were getting. So that's the reason that that is increasing. Page 13 is your sanitarian and water program. And page 14 are the purchase services of the sanitarian and water programs. And as we increase our fees, our percentage to the state also increases. That's why you're seeing an increase in that very first line of 10% to the state. Because as we increase our fees to the public, we have to pay more to the state for it.
We took it over from the state. How much are they collecting from us?
They get
Percentage?
10% of our revenue.
Yep, and that will increase to 12% over time. I think 10% off of this one, then it'll be 11% and then 12% topping out. So, and what that does cover is they do provide a lot of trainings for staff across the state that are at no charge. They have specialists that can come in and help out when something gets complex and we need that second opinion. They also provide us with an electronic record that everything goes in from the state to be managed. So that's what that fee structure covers that we pay back to the state.
So when we fix our fee structure for what we are charging the public, that expense is taken into account.
Yeah, so what we will be doing is as we're going forward with the budget, we will be re-looking at our fees in order to make sure that we're covering those costs as we go into the next fiscal year.
Yeah, because we have to at least cover
Yeah.
our costs. And
Yeah.
in fact, they never said anything anywhere in any papers I saw that we couldn't make a little teeny bit of profit.
Yeah, we need to be able to, we want to be able to show that over time that we're going to be able to use it up. But yes, we can be a little bit ahead. So the plan, which we'd like to be able to do is look at it for over a 3-year period. So that we would only be raising fees every 3 years instead of having to come back to the table every year. So we'll make sure we have that adjustment in there as we move forward.
Are there any questions on the budget or any questions on how it's prepared? Or what's taken into consideration?
Okay,
Looks like you did a great job.
yes, Patty, you presented it well. Thank you.
Patty, can you just explain too, like, I mean, each of the department budgets shows an increase, I think, from 2003 to 24, but the wages weren't calculated in.
Right. I didn't know if they already knew that or if you went over that at other. So in 2023, when we were told, actually, for the last 33 years, every time we did the budget, we have been told to come in at a 0% increase on salary and fringe. So nothing was ever projected. So there's 3% increase that was given in 23 in this budget, as well as Andy and Mike have instructed us for 2024 to project an increase in 424's budget. So you're actually seeing 2 years of salary increase in here. So that 150. So when we presented this to Andy and Mike, I said, hey, we're pretty good. Because that is a significant increase in salary and fringe, which you can see is, you know, our largest outside of purchase service. That's really where our costs are. And this does reflect a significant increase in that, which the 150.66 is reflecting.
I don't know, it's, yeah, but that's the way it is. I mean, salaries are going up, cost of living is going up, salaries are going up all over the place. So, thank you. Andy, you're okay? Okay. Future agenda items?
Does this have to, excuse me, does this have to have a motion or anything to go forward to the county board as in the past?
Okay, so we need to approve it here tonight, though. Okay, excuse me, thank you for pointing that out. I guess I would like a motion to approve the proposed 2024 budget for Health and Human Services.
I'll put forth the motion.
Okay, we have a motion and a second. Any questions? Did you have a question? Oh, okay, thank you. Okay, everybody in favor, say aye.
Aye.
Opposed? Okay, motion passed. Thank you. Now, future agenda items. Correspondence reports, conferences, anything? Okay, we're adjourned.